Mr. Speaker, I'm surprised the Prime Minister queries the advice of his own government up till the 12th of March. I do, of course, welcome any fall in the recorded numbers, and he's right to reference that. But the Prime Minister must still recognise the numbers are still very high. The Daily Telegraph this week carried the following quote from a cardiologist. "We discharged known, suspected and unknown cases into care homes which were unprepared, with no formal warning that patients were infected, no testing available and no PPE to prevent transmission. We actively seeded this into the very population that was most vulnerable." Does the Prime Minister accept that the cardiologist is right about this?
Prime Minister.
Well, Mr. Speaker, I have the utmost respect for all our medical profession who are doing an extraordinary job in very difficult circumstances. But what I can tell the House is that actually the number of discharges from hospitals into care homes went down in March and April, and we had a system of testing people going into care homes, and that testing is now being ramped up across all the 15,000 care homes in this country.
Keir Starmer.
Mr. Speaker, I want to probe the figures the Prime Minister has given us a little bit further. The ONS records the average number of deaths in care homes each month. For the last 5 years, the average for April has been just over 8,000. This year, the number of deaths in care homes for April was a staggering 26,000. That's 3 times the average. 18,000 additional deaths this April. Using the government's figures, only 8,000 are recorded as COVID deaths. That leaves 10,000 additional and unexplained care home deaths this April. Now, I know the government must have looked into this. So can the Prime Minister give us the government's views on these unexplained deaths?
Prime Minister.
Well, Mr. Speaker, coronavirus is an appalling disease which afflicts some groups far more than others. I think the whole country understands, and in particular the elderly. And he's right to draw attention, as I've said, to the tragedy that has been taking place in care homes. The Office of National Statistics is responsible for producing the data that they have. The government has also produced data which not only shows that there has been, as I say, a terrible epidemic in care homes, but since the since the Care Homes Action Plan began, we are seeing an appreciable and substantial reduction, not just in the number of outbreaks, but also in the number of deaths. And I want to stress to the House and also to the country that solving the problem in care homes is going to be absolutely critical. Getting the R down, not just in care homes, but across the country, is going to be absolutely critical to our ability to move forward as a nation with the stepped programme that I announced on Sunday. We must fix it, and we will.
Starmer.